Most of us have done a full blood picture in our lives and have been told that we have low hemoglobin levels due to low iron levels. Well, apart from hemoglobin levels being low or anemia being caused by low iron levels, there are many other causes of anemia. One such important cause is sickle cell anemia. Assalamu alaikum everyone, I'm Dr. Khadija, I'm a pediatrician, and inshallah today, being the 19th of June, World Sickle Cell Day, we are going to talk a little bit about sickle cell. Sickle cell is a disease condition that affects your red blood cells. Now usually your red blood cells are shaped like a disc or like a small bowl that carries oxygen to different parts of the body using hemoglobin. In sickle cell, the shape of the red blood cell changes. Instead of it being like a bowl that carries oxygen, it becomes like a moon. So this shape restricts the amount of oxygen being carried to different parts of the body, causing low levels of oxygen in tissues around the body. That is why most of the sickle cell patients experience pain in the body, joint pains, bone pains, and that is usually because of low oxygen levels. The other symptoms and signs of sickle cell anemia include pale skin, jaundice, frequent infections, frequent fevers, and fatigue. The disease presents itself at a very young age of almost about 6 months. Sickle cell is a genetic condition, so you inherit it from your parents. If you inherit one gene from either your mother or your father, then you develop sickle cell trait, or like we say, you become a sickle cell carrier. Usually carriers do not present with a lot of symptoms. They are mildly symptomatic or sometimes have no symptoms at all. But if you acquire one sickle cell gene from your mother and one sickle cell gene from your father, then you develop sickle cell anemia, which is the disease itself that presents with all the symptoms and signs that we discussed earlier. There are a number of tests that can be done to diagnose sickle cell, but the confirmatory test for sickle cell is HPLC. This test is a blood test and it is available in some of the labs around. Sickle cell anemia can be treated by bone marrow transplantation or by stem cell transplantation. However, this method is not frequently used due to the number of side effects it causes. But the good news is that if you follow these 4 main rules, then you can have a good quality of life. And these rules are: 1. Taking your folic acid tablets religiously, visiting your doctor regularly, being well hydrated, and having a good nutritional diet. If you know someone who has signs and symptoms of sickle cell, please ask them to seek expert advice. For more information on sickle cell, please visit the website given below. Thank you.